Thanks for joining me today. Our subject will be post-traumatic headaches, which occur commonly after a head injury. As I go over information on what causes these types of headaches and what you can do about them, feel free to pause and rewind this IntelaCare video at any time if you'd like to review anything I've said. Every year in the U.S., there are more than 1.5 million head or brain injuries. As I mentioned, many people who experience a head trauma will also experience headaches, even if the injury is minor. For some, the headache occurs instantly. For others, it develops over the first week after the injury. It's important to note that for most patients, the severity of the headache is not related to the severity of the injury. Therefore, people with mild head trauma may experience very intense headaches and vice versa. Fortunately, the pain typically diminishes over time, and the headache usually completely subsides within a few months. Now, what causes these headaches? Sometimes the headaches occur because of swelling or fluid around the brain. This builds intracranial pressure inside the skull, which leads to discomfort. Head pain may also be caused by muscles in the neck and scalp contracting after the injury. This tightness results in a headache. Pain can also be blamed on changes in the way blood vessels in the brain operate after an injury. These vascular changes can lead to a throbbing, pulsating pain. In addition to head pain, there are several other symptoms that may be associated with a traumatic brain injury. Here are a few of those symptoms. Dizziness is common. This feeling of lightheadedness may occur when you stand up too quickly, and it can feel as if you are about to faint. The official medical term for this is presyncope, and it describes feeling faint without passing out and is typically caused by a short period of low blood pressure. Insomnia and other sleeping problems also happen frequently after a head injury. The brain is responsible for programming the body's clock and telling you when it is time to wake up and when it is time for sleep. Therefore, if the brain has been damaged, the mechanisms that control sleep and other functions are sometimes thrown off, which can result in shorter attention span, memory loss, depression, anxiety, and personality changes. The symptoms related to personality changes are more common if the injury damaged the brain's frontal lobe. If you experience headaches related to a brain injury, there are things you can do to help alleviate the symptoms. First, make sure you're not doing anything that can make the pain worse. For example, alcohol and nicotine are two substances that can exacerbate headaches as well as hamper your brain's healing. Therefore, alcohol and nicotine should be avoided. Also, make sure you get enough sleep. If you're groggy and tired, you're more likely to have negative symptoms. If you're having difficulty getting enough shut-eye, establish a sleep routine and stick to it. When you go to bed and get up at the same time each day, your body is more cooperative at bedtime. The same goes for establishing a regular eating and exercise schedule. If you give your body the nutrients and movement it needs, you'll heal faster and feel better sooner. If you've tried these techniques and you still have headaches, call your caseworker and your doctor. There are other treatment options that may help, such as meditation and biofeedback. Also, there are medications that have been shown to ease head pain in people who have suffered a TBI. These include the same drugs used to treat tension headaches, migraines, and depression. As always, don't give up. Keep trying to find a solution until your pain is gone.